Hello friends, I am Dr. Dharmil Doshi. I am plastic and reconstructive surgeon working at Synergy Hospital, Rajkot. Today I am here to share with you a very rare and challenging case which we encountered a month ago. We had a 30-year-old male patient who presented to our emergency department with history of a machine part flung into his face and his face totally getting injured, including the left eye. We received the patient in the intubated state as he was vitally unstable. On evaluation, we came to know that the patient's left eye was damaged beyond repair. Also, he was having multiple facial bone fractures, closely communication with bone loss and soft tissue loss. He was having multiple lacerations involving the left upper and lower eyelid, the left cheek region, the left side of the nose, and the upper lip. On CT scan, the patient was found to be having fractures involving bilateral maxilla, the left orbit, the left zygoma. The fracture segments were grossly comminuted and it was beyond repair. The patient was taken up for an emergency surgery as a damage control surgery. With the help of ophthalmologist, we had performed the left eye evisceration and all the lacerated wounds were repaired primarily. Patient was then shifted to ICU and the critical care team managed the patient and he was stabilized. The patient then developed CHF flea also on day 3 of admission, which was managed conservatively by our neurosurgery team. The patient's bones were beyond the conventional open reduction and internal fixation repair. Hence, we had to think unconventionally in this patient to give him the face that he had lost. Our main targets being the patient should be able to breathe properly and the patient should be able to eat properly. The last goal was to give cosmetic appearance also. So we sent the 3D CT scans of the patient to a company which was involved in making 3D printing images and customized implants. We got the implant for the patient customized to his measurements and the patient was taken up for surgery on day 10 again. During this surgery, our goal was to remove all the pieces of the bone and the soft tissue that was unhealthy and place the implant while also fixing the contralateral, that is the right-sided maxilla. The surgery went on for almost 7 to 8 hours and during this surgery, we were able to achieve all the goals that we set out to accomplish. The patient was shifted to ICU for overnight observation. On the next day, the patient was shifted to ward. On day 3, the patient was able to breathe properly and on day 7, the patient was discharged. At 2 weeks after surgery, the patient showed to us in follow-up in OPD and we started the soft diet.
मेरा नाम लालचंद है। मैं फैक्ट्री में काम करता था। मशीनों में चोट लगी। अब मैं पहले से बहुत बेहतर हूँ। खा भी सकता हूँ, पी भी सकता हूँ, बोल भी सकता हूँ और अब मुझे पहले से बहुत अच्छा महसूस हो रहा है। ये सब डॉक्टरों की वजह से, लोगों की मेहरबानी की वजह से आज मैं बहुत अच्छा हूँ।
જે બે મેઇન હેતુ હતા કે પેશન્ટ શ્વાસ લઈ શકે બરોબર અને ચાવી શકે એ આપણે અચીવ કરી શક્યા છીએ।
हम अपने डॉक्टर धर्मिल जोशी का बहुत बहुत धन्यवाद और बहुत बहुत थैंक यू। उन्होंने हमारा पेशेंट को एकदम बढ़िया से रिकवर करके हमको दिया।
And the patient is now gradually getting back to work with his face which was reconstructed and with normal chewing movements, normal breathing patterns. And now we are also planning to give him a prosthetic eyeball for the left eye, which will further improve the cosmesis. I'm glad to share this case with you, and we will keep striving to work towards the betterment of our patients. Thank you.